I'm Dr. Lasya Sindhu. I'm an ENT surgeon and a neuro-otologist. So today I would like to talk about the topic tonsillitis in kids. So all of us know that this is one of the most common problem that the kids suffer with, which is the chronic tonsillitis. First, we need to understand that not everybody who has tonsils needs to be operated. All of the kids, like usually a lot of kids have tonsils, but they all need not get operated. Only if the frequency of throat pain in an year is more than 2 to 3 times in a year, and if the child has severe throat pain and he has difficulty in swallowing, so that time, if the again as I told you, whenever the condition is acute, first we give a course of antibiotics. During acute tonsillitis, we never operate on the child. First, whenever there is acute tonsillitis, we always give medication. And once this subsides and we find that the child falls under the category of chronic tonsillitis, and if the grade of tonsillitis is more, and if the child is finding it difficult in his day-to-day activities, that is the main reason we ask them to get operated, and we do a certain procedure known as tonsillectomy. So one of the other reason why we do tonsillectomy in kids can be OSA. Okay, OSA is obstructive sleep apnea. Typically in these kids, the tonsil is very enlarged, typically grade 4. There is very small space for the air to go through the mouth, and also there is adenoid hypertrophy. As I told you, there might be the adenoid behind the nose. So typically when there is very little space for this kid to breathe, they suddenly wake up in the night, they have choking spells at night, they feel sudden breathlessness at night. So in these kids, and typically you see they are mouth breathers. So in these kids also we do tonsillectomy. So coming to the tonsillectomy, it is of various kinds. First is the basic cold steel method, where basic ENT instruments are used and we can remove the tonsils. However, with latest advancements, we have bipolar technique, where we remove the tonsils with bipolar cautery, and then we have cobblators, which is laser assisted. We can remove the tonsils. So these are typically bloodless surgeries. So as we have advanced in these techniques, you can always choose which procedure you want for your child. But again and again, I would like to tell, not all tonsils need to be operated. There is a certain criteria, and if your child is really suffering from chronic tonsillitis and it has been becoming difficult for him, then only we operate in these kids. Thank you.